When preparing for a surgical first assistant interview, it's essential to consider the types of questions that may be asked. One common inquiry is about the motivation behind choosing this career path. Interviewers often ask about the factors that led to this career choice, as it provides insight into the individual's passion and commitment to their work. This question serves as an introduction, allowing the interviewer to get to know the candidate and understand what drove them to pursue this profession. A possible response could be that, initially, the goal was to become a surgeon, but the required number of years of education and specialization led to a reevaluation of priorities. Becoming a surgical assistant emerged as a viable alternative, offering the opportunity to work in the operating room and contribute to patient care without the lengthy educational requirements. Another crucial question that may arise is how to handle a situation where a surgeon appears impaired or unsafe to perform surgery. Unfortunately, such scenarios can occur in real-life situations, and the interviewer wants to assess the candidate's ability to prioritize patient safety above all else. The correct course of action would be to immediately notify a supervisor about the concerns, as patient well-being is paramount. Even if the surgeon is ultimately found to be capable of performing the surgery, it's always better to err on the side of caution when patient care is at stake. Interviewers may also ask about a particularly challenging case the candidate has worked on. While this question may seem like an opportunity to share a difficult story, its primary purpose is to evaluate how the candidate copes with complex situations. When responding, it's essential to maintain patient confidentiality and focus on the skills and strategies employed to navigate the challenging situation. For instance, a candidate might describe a case involving a young patient who had been in an accident, and the emotional and technical challenges that came with it. The question of what the candidate hopes to accomplish if offered the position is also crucial. The response should focus on integrating into the team and department, rather than making drastic changes or focusing solely on personal benefits. A suitable answer might emphasize the desire to learn about the company culture, build relationships with the team, and identify ways to become a valuable asset. This approach demonstrates a willingness to adapt and contribute to the organization's success. Finally, the interviewer may inquire about the candidate's future plans, including the possibility of pursuing higher education or changing career paths. This question allows the interviewer to understand the candidate's long-term goals and how they might align with the company's vision. If the candidate has considered furthering their education, they should feel comfortable sharing their thoughts, while also highlighting their current strengths and the value they can bring to the organization. A potential response could be that, while additional education is not currently a priority, the candidate is passionate about their work as a surgical assistant and is committed to continuing to grow and develop within the field.